Hello, this is Dawn McAdams, the lead nurse for Richland School District 2. I'm going to talk to you today about Return to Learn, concussion management in the classroom. What is a concussion? A concussion is a traumatic brain injury that's the result of a bump, blow, or jolt to the head or body, anything that causes the brain to jar back and forth, front to back, side to side. It causes the brain to bounce around and twist inside the skull, which stretches and damages the brain cells and creates chemical changes in the brain. It's a functional event, not a structural event. This is why if someone goes for a CAT scan or an MRI, it may not necessarily show anything structurally wrong because it really occurs at the cellular level. It alters the way the brain functions. The effects are usually temporary. Again, they're caused whenever there's that large jolt or force, a blow to the head, the neck, the body, or when you're violently shaken. It can result in a loss of consciousness, but that does not always occur. A little bit here about myth versus facts when it comes to concussions. A myth, a concussion only occurs as a result of a direct blow to the head, and the fact is it can be caused by a direct blow to the head, body, face, neck, or elsewhere, whenever the force of the impact is transmitted up to the head. They can occur with or without consciousness, and about 90% of concussions do not have a loss of consciousness. There's various factors, including age, gender, medical history, what sport or athletic event you're participating in, as to the risk for a concussion. So the myth is that everyone is at the same risk, where the fact is it's very individual. It is a myth that it is safe for a player to return to the same game or practice after suffering concussion-related symptoms. Because there are so many different signs and symptoms of a concussion, any athlete who has symptoms should not be allowed to play the same day, even if the symptoms clear quickly. And in concussion management, no two concussion treatments are alike. No recovery trajectories are alike. It is a myth now that you have to stay in a darkened room to recover from a concussion. The evidence-based treatment shows that the more active we can get people at a graduated pace with mild exertion and different therapies, the quicker people can recover. Proper clinical management really helps when we are dealing with students with a concussion. So in 2013, the South Carolina legislature passed a return to play law, which impacted student athletes. It gave a graduated return to play for the athlete who has sustained a concussion. But we've really never had any specific guidance for non-athletes who sustain a concussion. And the healthcare needs are the same whether you get a concussion from playing soccer or a student gets a concussion because they fall off their bike or out of a tree and hit their head. So last fall, in October of 2016, the 5th International Consensus Conference met to talk about concussions in sports, and they met in Berlin, hence we have the Berlin guidelines. And those new guidelines for return to play and return to learn came out in May of 2017. So we're really learning that concussions fall on a very different trajectory depending on the person that is injured. You can have cognitive impacts, fuzzy thinking, confusion, fatigue. It can affect your vestibular system, your balance, which can lead to feeling dizzy, feeling out of balance, walking uncoordinated. It can affect the ocular system with the vision. You can develop post-traumatic migraines, cervical neck pain from the concussion, and it can also affect your mood. It can lead to anxiety and depression. So we've really learned a lot about concussions over the past few years. So some of the symptoms we immediately think of are headache, nausea, vomiting, dizziness, sensitivity to light and noise, confusion or fuzzy thinking, balance problems, irritability. They may be anxious, nervous, sad, have difficulty concentrating, be fatigued, forgetful, drowsy. Those are all common symptoms of a traumatic brain injury or a concussion. So we have a form that we can send out to teachers notifying them that one of their students has sustained a concussion. Sometimes it may come by email, or you may see this initial concussion acknowledgement form. Some of the accommodations would be to allow the student to go to the nurse if the symptoms worsen during class, allow the student to minimize use of technology if needed, allow students to have extended time for projects or assignments, tests, quizzes, let them go to the tutoring center to make up missed quizzes and tests, and to have 2 days of makeup time for everyday symptomatic if needed. Some other interventions we can put into place, I have blue screen filters that we can put over their electronic devices to help cut down on the blue light emission that can add to the concussion symptoms. So other interventions we might put into place are a shortened school day, limit their screen time, an elevator pass to avoid the exertion of walking up the steps. We may need to consider where they sit in the classroom. If direct sunlight comes in, avoiding the glare from screens, they may need sunglasses. Temporarily, they may need to be removed from PE, music, chorus, orchestra, band. The noise from the chorus and orchestra and band and the exertion in PE can cause a person to have more symptoms of their concussion. And this would be a good time for them to come to the health room and lay down and just kind of rest and regroup. They may need shortened assignments, 10 math problems instead of 20, 10 minutes of reading instead of 30 minutes, delay their testing, test over days or in chunks. May need to consider standardized testing, ACT testing, SAT testing, and whether that student should go ahead and test that following week or whether they need to postpone to another testing date. So the athletic trainer or the school nurse evaluates the student's symptoms every day using a symptom checklist. We notify teachers of traumatic brain injury symptoms and what to look for, notify the IAT and the 504 chair, because we're going to put things into place for about 10 school days. And if we go beyond 10 days, we really need to meet as a team and decide if there's further interventions that need to be put into place, if this student needs to be considered for a 504. This is the post-concussion symptom scale. It's self-rated by the student on a scale of 0, no symptoms, to 6, severe. And we look at headache, pressure in the head, neck pain, blurry vision, balance problems, noise sensitivity, not feeling right, feeling like you're in a fog, confusion, drowsiness, sadness, and we total up their score. And we look at this over successive days, and hopefully their symptoms are decreasing as we go over time. If not, it's a time that the nurse and the athletic trainer really need to work with the parent and the healthcare provider on next steps for the student. Other considerations have to do with how social adolescents are. And when we take away their social structure and support, they may develop signs of depression and anxiety. They feel like they're letting their team down. Maybe they're concerned that they're going to lose their starting position on the football team, or they're falling behind in their classwork because they are having to miss school or miss certain class periods. They may miss out on social events. So we never want to discount the social emotional factors of students that sustain a concussion. This is the post-acknowledgement concussion form, or you may get an email when a student is deemed clear of the concussion. We do send a notification out to the teachers as well. So when we're dealing with students who have sustained a concussion, our ultimate goal is education, but it really takes a whole team. It takes the teachers, the parents, the student, the teammates, the nurse and athletic trainer, the coaches, the physicians. It's all a team effort to make sure we have the best possible outcomes for students who sustain a concussion. If you have further questions, please don't hesitate to contact me. You can contact your school nurse for further information or one of the school athletic trainers. Thank you and have a good day.